Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, viewer-submitted questions, and our lone U.S. COVID statistics through today, March 6th. We invite you to submit any questions or suggested topics down below via any of our social media linked in the description or in the comments. Starting with that COVID statistic. In the last reported week, average COVID deaths per day were 71, while in the same week in 2024, we saw 198 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the standing of COVID in the US?
Yeah, so the numbers are starting to drift down already because the big respiratory disease season is kind of just starting to come down. So January and February are the worst months. And so we're seeing a slight decrease. And the other good news, of course, is that it's much less than it was in 2024. So that's good, going in the right direction. There is a new strain, LP81, and that makes up about 42%. It's an Omicron strain. We don't expect really much difference, but of course, it transmits even easier. That's why it's taking over. Looking at the wastewater activity, it's dropped from high or very high to moderate in most areas. So, that's, again, everything's going in the right direction.
Mm-hmm. And while we're on the topic of COVID still, we have a first submitted question from today, which is, when the updated COVID vaccine came out in September, did you, Dr. Murphy, recommend that people over 65 get a second dose of that vaccine 6 months later?
Yeah, that is the actual recommendation. So if you're at high risk, which is over 65, or you have some other, really underlying serious diseases, it's up to you and your physician. Not only getting the new vaccine, which came out in early September, but repeating that vaccine 6 months later is the formal recommendation to keep you as healthy as possible.
Mm-hmm. And picking off of that for a younger group, the infants, there was a big study that was published recently in JAMA Network Open on children, vaccination, and long COVID. Can you break down that data for us?
Yeah, this is a study of 622 children, ages 5 to 17. Now, only about 1 to 3% of children get long COVID, but still, they get sick. And it turned out that in the kids that got long COVID, there was less long COVID in kids who were vaccinated, 57% less, having one long COVID symptom if they were vaccinated, and 73% less if they had 2 or more symptoms, so if they were even sicker. So this kind of all makes sense. You don't get COVID, and if you get COVID, you don't have long COVID. So not only does that happen in adults, but it happens in children too.
Now, our second question for today is a very important one. And it reads, what is going to happen with vaccines this year, specifically the flu vaccine, as the Health and Human Service Secretary canceled 2 meetings with ACIP and the FDA for those flu vaccines next year? Can you answer the question and also break it down a little bit for us with the context?
Well, yeah, we stopped having our meetings of external experts from around the country and the world to assist with making a decision on what vaccine to use and when to give it. We were withdrawing from the WHO, which is the group that coordinates the overall worldwide effort in determining what vaccine would be best for the next year. We make that vaccine based on what's going on in the Southern Hemisphere, in basically our summer. So, because it's their winter, it's their flu season. So anyway, we're not part of that, but there is some interaction still between FDA and CDC There's a couple meetings that the representatives went to. And one little loophole is that we have not withdrawn from PAHO. PAHO is the Pan American Health Organization, which is a branch of the regional branch of the WHO. So we're still in PAHO. So we've got their data, and there is some cooperation, but it's just this basically half-baked relationship. You're either kind of in or you're not in, and this just can't be good. This is not optimal. This is not how you deal with these worldwide infections that travel around the world. I mean, everyone has to really work together for everybody's benefit, and I mean that's kind of where we stand. So we're not as a good position as we could be.
And it may be a little confusing because we right now are nearing the end of the current respiratory season. But why is it that, regulators and manufacturers would need a longer time to produce this vaccine as opposed to, the COVID vaccines, the mRNA vaccines that seem to be ready much quicker?
Well, that's a really good question, and a lot of people are working on that, including the new interim director of the NIH. It takes a long time to get this vaccine made. It's an older technology that's been around for a long time. And that really needs to be upgraded. You're absolutely right. And, hopefully there is work in this particular area that this will be the case in the future. But right now we're stuck with basically old technology. They're not even, like this year it was less than 50% effective, but less than 50% is still a lot. So that combined with all the other vaccines you had in the past, and maybe you had flu as well, it's enough to keep this down to a dull roar. But, even so, this year, CDC has estimated that 21,000 people have died from the flu, and this includes 98 children. So it just, it's still a life-threatening illness, particularly if you're at high risk.
hmm And something very interesting specifically about those 98 children who very sadly passed away from the flu is that there was a study with findings of higher than expected rates of encephalitis caused by the flu. Can you tell us about that?
Yeah, so the 13% of children who died from the seasonal flu this year had an influenza-associated encephalitis or encephalopathy, a swelling of the brain. And that's probably why they died. It just tells you, this is a serious disease. People shouldn't just write off flu as, oh, it's just something, you get it. 21,000 people died. Almost 100 kids have died. Kids get encephalitis from this. And so I think it's just the message is take it seriously. And there is still, even though I've said that the numbers are coming down, there are some places where they're still in the very high range. There's some places close to where we are right now, including Michigan, Ohio, Massachusetts, New Hampshire, and Maine. Still have very high amounts of flu floating around. So it depends on really where you're living. But overall, the season is trending downward, and of course that's good. But it's another season with a lot of deaths and a lot of problems.
Mhm. Now, a different flu strain that is not trending downwards, unfortunately, is the avian flu, H5N1, also known as the bird flu. There have been a couple of updates on human cases of the avian flu, as well as some other mammals that are getting sick. Can you break it down for us?
Yeah, so there's still no human-to-human transmission. So that's great. They haven't had a big spike in cases recently. The cases we reported on, the one from Ohio was discharged from the hospital. The Wyoming patient who had the D11 strain, which is the bad strain, the worst strain, that person also was released from the hospital. That's great news. They've discovered some of the mutations associated with this bird flu strain. And, we're kind of where we were even a week ago. The difference is now people are reporting outbreaks in different animal groups. So in New Jersey, there was a cluster of avian flu in cats. One of them, at least, had neurologic symptoms and had to be euthanized. And the cats probably were exposed to some birds either in the wild or whatever. And it just this is the big unknown. We don't know in the animal world, how much bird flu there is. Every time they start looking, they find it. And not every mammal is going to die from flu like the birds. The birds are like devastated if they get it. But so, this is a big gap in our knowledge because, this disease it's mutating constantly. It's in all these other animals, and we don't really know where it's going to go.
Lots of unknowns there. And looking a little to a different place in Texas, where we've been seeing the measles outbreak. Are there any updates you can give us on that?
Yeah, so the outbreaks, the number of cases in Texas is 159 right now. That has resulted in 22 people being hospitalized and one child dying. That was the first death since 2015, and the first in a child death since 2003. We're going in the wrong direction there. In response, the state actually reached out to the CDC's Epidemic Intelligence Service, or EIS, which was disbanded just a few weeks ago, but then reformed, like a week or so ago, because these are the people that go out and investigate these outbreaks. So, the EIS service has been around for a long time and has really been instrumental in every outbreak of any kind of food poisoning or, any kind of health-related disaster in the United States and worldwide. So fortunately, they're back on track. It's a really great service that is done there. So, uh, you know, this is what's going on, and what's happening is the EIS recommendations, the CDC recommendations, is that people should be up to date on their vaccine, but they cannot force the vaccine, and many people there are still not taking the vaccine. There's a lot of talk about taking vitamin A and all this other stuff. This is okay. This is not going to help prevent measles. This is really a drop in the bucket compared to what is needed. This is not going to impact hospitalizations or risk for death. We had always said there was like 1 in 1,000 people with measles will die. That's the kind of the typical number that you see associated with death and measles. And here we have 159 and we already have 1 death. So vaccine is the most effective way in preventing this disease. And people have to take the vaccine.
Yeah, and it's important to note, as you mentioned, with that vitamin A, there was a study linked in the White House's or the government's announcement about this outbreak that talked about vitamin A potentially helping with mortality of measles, but that is only alongside full measles vaccination. So we can't cherry pick that information and say just the vitamin A. That was specifically for people who were very sick and were already vaccinated for the measles. So an important note there to keep track of.
Yeah, we don't want to extrapolate or make up any data based on that. So it's and that's after they already had measles, so it's not going to prevent anything.
Absolutely. Now, our final story for today is also not a particularly happy one, but checking back in with the Democratic Republic of Congo. We talked about a mystery illness last week that was testing positive in some cases for malaria, but now things have gotten, even more complicated. Can you tell us where the outbreak stands?
Well, this part of Congo is very unstable. There's warring factions. It's anarchic. There's a lot of problems over there. They don't understand what's going on with this sudden 53 deaths, most occurring within 48 hours of symptoms. And there's over 1,300 suspected cases. Now, a very similar thing had happened, several weeks or months, a couple months ago, and it turned out to really be just different forms of malaria in combination with malnutrition and other underlying diseases, and it was nothing new. So everyone's worried about something new happening. We don't know what this is. It's in Equator Province, a smaller one, and there in one village there were 24, and the villages there are small, unexplained 24 deaths from a single village. So they don't understand really what's going on. They even think that it could be a chemical cause, such as an organophosphate contamination, some chemicals or something like that. But none of this has been proven. Nobody knows. They are sending investigators to try to figure out what's going on. It doesn't look like it's Marburg or Ebola, the viruses that have also been reported from this area, and which don't behave as quickly as whatever is happening there. I mean, you're sick for a while if you have Marburg or Ebola, you don't die within 48 hours. So I don't know. It's under investigation, and it's a problem that hopefully we get an answer to in the near future.
Absolutely. We will keep our eyes and ears open for any news regarding that outbreak to see what the root cause is. But on that note, that is our time. Thank you so much, Dr. Murphy, for your time, your expertise, breaking down the stories and all the data for us.
Well, great, Katie. Thank you so much.
And thank you all for joining us for this week's episode of Ask Dr. Murphy. We hope you enjoyed. As always, if you have any questions or suggested topics, please leave them down below in the comments or linked in the description at any of our social media. Have a great weekend.
You too.